The need for palliative care in Jamaica continues to grow as more persons are being diagnosed with non-communicable diseases, including cancer. It's why consultant oncologist Dr. Dingle Spence is calling for more awareness in this area in order to help improve the quality of life for affected individuals. Here's TVJ's Shamela Pullen with this evening's health report.
The health report: each year, an estimated 40 million people worldwide are in need of palliative care, 78% of whom live in low and middle income countries. That's according to the World Health Organization. Consultant oncologist Dr. Dingle Spence says Jamaica is no exception.
So now we can't cure you, whereas we probably could have at the beginning. And so we see people with awful wounds, their breast has been taken over by the disease, they have a lot of pain, the cancer has spread to their bone, maybe their brain, their lungs. So, I think this is an appeal at this point to say, get it sorted out early, and then you may not need palliative care at all. But we are seeing, in our country, we see people come to us with advanced disease. Also cancer of the cervix. A lot of folks don't get their pap smear done, so then, they may have a cervical cancer, they may have a lot of bleeding, a lot of pelvic pain.
Dr. Spence, who is also the Senior Medical Officer at the Hope Institute and co-founder of the Jamaica Cancer Care and Research Institute, says early palliative care reduces unnecessary hospital admissions. She says there is also a myth that palliative care is for dying people.
We know actually from significant studies in the US that the earlier palliative care is introduced, so maybe even in the last year or two of life, people actually do better. So we don't want to say palliative care is just for the dying, and I would like to dispel that myth today, that the earlier that you are introduced to palliative care, the longer that we can have a relationship with you and your family and get to find out, what's important to you.
The oncologist says the Ministry of Health is currently looking to introduce palliative care in the primary care system.
The actual priority is trying to improve palliative care in the health centres and in the community so that hospital beds are not taken up by folks who could actually be better looked after by the health centres or at home. That obviously requires will and education, not just of the professional public, but of the public that might be served by those services.
With your health report, I'm Shamela Pullen, wishing you good health. The health report